Good evening. Welcome to another edition of Cavanaugh's Corner, the labor talk show in southern Maine on public access television. I'm joined this afternoon by Joe Ditre. Joe is currently the executive director of the Maine People's Alliance and has been an activist with the Consumers for Affordable Health Care, sort of helping to lead the fight for healthcare reform in Maine for a few years. Joe, welcome to the show.
Thanks, Mike.
We are going to be spending today talking about the issue that's probably foremost in the public attention right now, and that is healthcare reform. We're taping this show in late July of 1994, and the Congress is on the threshold of debating and voting on national healthcare reform. So, Joe, let me ask you to help for our viewers here in southern Maine to put this in some context. Where discussion has gone on about healthcare reform for some time. We're coming to voting on something we'll be discussing in some detail, but tell us a little bit, if you will, how is it that we got to this point? What's the genesis of the healthcare reform effort? And help us, bring us up to this date, if you would.
Sure. Prior to the election in 1992, we saw in many states consumer organizations and labor organizations and churches and citizens just across the nation saying that they were paying too much for health care. They were not able to get health insurance because the insurance companies wouldn't take them if they were sick or if they had an illness or whatever. And so there began this movement back in the mid to late 80s amongst consumers basically to change their health insurance and healthcare system. And this has had tremendous impact. In Maine in particular, we've gotten substantial and major changes to our health insurance system and towards controlling healthcare costs. However, we have not addressed, and no state in the United States, with the exception of Hawaii, has actually gotten to the issue of universal access. While every other country in the world has universal coverage for the citizens, only the United States does not. Amongst the industrialized Western nations, and we fall in company with South Africa, as not having universal coverage for our citizens. This status of having ranking 22 in infant mortality of countries in the world, of 20th in other types of mortalities, has created a situation amongst the population where we're saying, what are we getting for what we're paying for? Mm-hmm. And so there was this extreme call for reform. And George Bush, then president, responded by saying, we don't need to deal with this. Mm-hmm. This is really not an issue. Mm-hmm. And I think that actually led to his demise going into the 92 elections, mm-hmm. where so many people were out there calling for reform, and he was just rejecting it and saying, we don't need to do anything.
Right. Wasn't it the case back even in 1990 here in Maine? Many people remember when Neil Rold ran for election to the Senate. He was not successful, but he raised this issue of healthcare reform to be really the issue on which his campaign was based, right?
And absolutely, one of the first Senate campaigns in the United States, mm-hmm. based on a single-payer health insurance system, mm-hmm. in which we didn't have to deal with mm-hmm. these middlemen called mm-hmm. insurance companies, mm-hmm. taking our dollars, skimming off the top, and then putting a little bit into healthcare services. Mm-hmm. He was one of the first, in fact, the first to run mm-hmm. An entire U.S. Senate campaign. Right. Got 40% of the vote against a very, very popular incumbent senator.
Right, and then in Pennsylvania, the next year, Harris Wofford ran for and won in a major upset. He ran for the United States Senate, again, based largely on the need for health care, national health care system, universal health care. And those should have been, I'm sure there are people in George Bush's organization who probably kicked themselves thinking we should have been on with this thing because something was happening out there in the country.
Yeah.
But we then get to the 1992 presidential election, and what role did the fight for health care reform take in the presidential campaign?
I think it was absolutely critical to Bill Clinton's victory. And there was a lot of talk within the Clinton campaign about change and reform and making the nation strong again. And when you looked at what the polling data was showing, it was actually the healthcare issue that resonated very, very highly with people. That the economy was flagging, and there was no action being taken by the incumbent president to turn that around. And then healthcare. There was no action on healthcare. It was more status quo. And here comes a guy saying, I'm going to work to change this system. Healthcare reform is absolutely essential. And it resonated with the voters. They wanted to see that change made. They were not happy with the status quo.
Right.
So a whole election can basically be focused on this as one of the key issues that won that election.
Yeah, I think people that I work with here in Maine and Biddeford and so on really had, I think, very high expectations going in. I mean, there was a lot of excitement and enthusiasm around the Clinton election, and for a lot of reasons. But I think primarily most of our folks, most of union members that I deal with in Maine, would have identified universal health care as the primary reason that they were excited about the opportunity to elect Clinton. And because the campaign did, and particularly Hillary Clinton was out there sort of leading as a leading spokesperson for the need for universal health care coverage. So I think that people rightfully had pretty high expectations of what this election was going to mean for the effort for health care reform. But not to minimize it, I mean, a lot of people knew going in that this was not going to be an easy thing to change. You want to talk a little bit about what are the forces that were lined up to impede change in healthcare?
Yeah, absolutely. When the president was running, he said that within the first 100 days of his administration, there would be a healthcare plan that would basically revitalize the entire healthcare system. It would change access. It would change the way that we pay for the system. It would basically streamline the cost within the system and help with the paperwork. It would make it so that no one could ever lose their coverage. And that was all exciting and new, especially to all the people, the 15 to 17% of our population that have no health insurance. Here in the state of Maine, there's over 150,000 people who have absolutely no health insurance out of 1.2 million people. So that was all very exciting, very new, something that people wanted. And what happened was, in order to basically look at and deal with this very complicated system that we have now, the president employed many academicians and people who were knowledgeable about the healthcare system to try to create a system which is something like what we have now, so that people would understand it, so that they would be able to accept it. And in that process, it did two things. It slowed down the debate. It slowed down the fervor and a level of support that the president was getting on the healthcare issue. And that created the opportunity for the special interests, those who only stand to gain by the status quo and the existing system, to basically pounce and try to convince the American public that this was a wrong way to go. The second thing it did was only made the system more complicated. There is a grain of truth to the critics who come out and say, look at this system. And while in fact they in fact, I mean, this is going to be hard for some of your viewers to believe, they did in some sense simplify the system by having these entities that these regional health alliances, which would only allow a narrow number of insurance companies that really wanted to provide insurance and really wanted to do something about health care costs, to participate, and all the rest of ones would have to really get out of the system because they wouldn't be getting all the profits that they wanted. That it became more confusing for people, and it was, and the critics really slammed the president on it. They made it seem even more complicated than it was, and to a lot of us out here who support a single payer system, we said, this is more complicated than it needs to be. It's better than the system that we have, but it's more complicated than it needs to be. Why do we need these middlemen?
Right. Well, over the last year or 9 months, really, since I guess the president laid out his plan, there has been increasing noise and distortion about what the reforms are supposed to do, how they're supposed to work. There's been a lot of analysis about how it's all been shifting, and I think in the minds of the average person out there, they're more confused perhaps than ever about what is it that we're trying to accomplish with healthcare reform, and to that extent, I think the opponents of healthcare reform have been successful in essentially getting more and more people to believe that the devil you know is better than the one you don't, and I think that's been a conscious strategy in their parts. But perhaps to help our viewers think about this and help us to talk about it a little bit, let's see if we can go back a bit to after the president's election. You said that he had promised that within 100 days he'd roll out the healthcare reform package. That was a deadline they weren't able to meet, and ultimately, and I've forgotten how many days it took beyond 100, but ultimately there was a presentation that the president made of his healthcare reform proposal that was made to a joint session of Congress, and at that point they then released a PR campaign of some degree to try to explain their system, and the president to try to explain his reform proposal to the American people. And if we might, let's take a look here at a few minutes of a videotape that the president and the Democratic National Committee produced that purports to lay out what the president's original proposal was. So we can go to the videotape, and if we're queued up properly, let's take a look at this.
When you're uninsured, you live every day scared to death.
You feel like you're walking on a tightrope.
I've been without any insurance now for almost 7 years.
Sick and bang, everything's gone.
It will devastate you.
Because I can't get health insurance, my kids don't have health
We're
insurance.
in danger of catastrophic medical expenses at any moment.
I never dreamed that paying insurance premiums would be #1 priority on our budget.
And the first question is not what's wrong with you, but do you have health coverage?
You don't realize that you purchased an inadequate policy until you have a critically ill member of the family.
I cannot possibly put away the kind of money I need to keep myself alive.
As long as you're happily insured and don't get sick, there's really no problem.
You start to wonder what's important. Is the patient important, or is the dollar what's important?
You end up spending almost as much on paper as you do on providing care.
All of the paperwork and phone calls take time away from time you want to spend with your
This
patients.
is not the system I thought I was paying into.
Things have got to change. Who's going to be brave enough to start the change?
Every American deserves to have health insurance.
We need help.
The voices you've just heard belong to only a few of the many millions of Americans who are anxious, frustrated, and whose lives in many cases have literally been torn apart trying to deal with the American healthcare system. For decades, we've seen our healthcare system become ever more wasteful and inefficient, costing all of us more and more each year, yet leaving more and more of us without the security of knowing that when we need healthcare, it will be available to us. Americans live in fear of losing their health care coverage. Every month, 2 million do. And 85% of them live in families where the head of the household is working. The fact is, 1 out of every 4 Americans risk losing their health care in the next 2 years unless we adopt health care reform that makes it illegal for this to happen. Our plan does that. In coming up with our plan, we followed 6 guiding principles. First, security, guaranteeing you that no matter what, you can never lose your health care coverage. Second, simplicity, closing the loopholes and reducing the bureaucracy that are bringing the system to its knees. Third, savings, by bringing skyrocketing costs under control. Fourth, choice, maintaining your choice of doctors and giving our people even more choice of plans. Fifth, quality, protecting and in many cases improving the quality of American health care. And finally, responsibility. Our plan asks every American to take responsibility for reforming the system. In short, we have got to preserve what works in our system, but we've also got to fix what's broken.
I wonder how many mothers, the last thing that they say to their kids when they go out the door to ride their bicycle or to play with their friends, the last thing they say to them is, be careful while you're out there. Remember, we don't have any insurance. If you get hurt, they could take our house away.
You have to explain to your child that we're going to get you a pair of shoes soon, but we have to get grandmother and grandfather's medicine, or your father or your mother's medicine. That's an extremely difficult choice.
After I got sick, I lost my job. With that, I lost my insurance. And then I depleted what little savings I had on medical expenses.
Once we get laid off or the job goes out, then our insurance goes out with it. And if we have a pre-existing illness, there's no way to purchase it. There's no insurance that will take you.
Due to our age, they say that, new insurance companies do not want us. They have policies, but they don't want us.
Even when we were able to afford insurance or when our companies paid the premiums for us, the coverage that was there was inadequate.
So we're sort of locked into a plan that's becoming more and more expensive, not providing any more benefits.
I'm really concerned that my job may not be there in a few years. My boss may not be able to stay in business if these premiums keep going up and up.
We would like to provide benefits for our employees. We feel like they're deserving of it, but the prices are extremely high. The companies are undependable. You don't know from one day to the next whether it's going to cost you more money or whether they're going to be around or whether they're going to cancel you or whether they'll even honor the claims that your employees bring to them.
We're all at risk. As long as the insurance companies can pick and choose whom they will and will not insure, then we're all at risk, and medical insurance has become sort of a myth and a scam. The insurance companies are selling insurance, but really what they're delivering is uncertainty.
These are people like you and me, people who work hard and play by the rules, but the system has failed them, and their stories and millions of others they represent underscore the absolute pressing need to guarantee health security for everyone. So our plan offers this ironclad guarantee. If you don't currently have health insurance, you will. And if you do, it can never be taken away. We must achieve this security as soon as possible. Let me tell you how that's going to work. First off, under our plan, every legal resident of this country will get a health security card, which no one can take away. It guarantees you access to a package of comprehensive benefits as good as most Fortune 500 companies offer now. And that goes for everyone, whether you're employed or not, whether you work for a huge company or a small business, and it'll be illegal for your insurer to raise your premiums as much as they want or to drop you for simply any reason, even if you get sick or change jobs or lose your job. You're covered. No one can take it away from you, ever. Let me tell you how the plan is going to work for you. It's really pretty simple. Under our reform, most of you will still get your health care coverage the same way you do now, through your employer. They'll give you a brochure that will describe the plans you can get, along with how much they're going to cost. You'll have a choice of at least 3 plans, and everybody will have the option to join a plan which guarantees you that you can continue to go to the doctor you see now, even if he or she doesn't belong to your plan. In many cases, you'll have a greater choice of doctors and plans than you do now, because more and more Americans in the workplace only have one choice. You should also know that if your employer currently pays 100% of your premiums, he can certainly continue to do that with less threat of rising costs. In other words, our program doesn't take anything away from you that you have now, but it guarantees that there are some things that no one else can ever take away from you. If you're self-employed or not working, it'll work pretty much the same way, except that instead of going to your employer, you'll sign up at the Health Alliance in your area, which will be run by consumers and local businesses. They'll bargain for affordable health care for you. So now you've picked a plan, and you're covered. If you need to go to the doctor for a checkup, or if you get sick, you'll simply take your health security card, show it at the doctor's office, and they'll take care of you. Then you'll fill out one standard form, just one, and you're done. And no matter which plan you pick, you'll be guaranteed a comprehensive package of benefits which will offer you a wide range of services, and unlike most current insurance, you'll get preventive care, including mammograms, regular checkups, pap smears, and immunizations for children. So health security will guarantee that you won't have to wait until you're really sick before you go to see a doctor. Also, we're going to include coverage for prescription drugs, which are now so costly that they're forcing many older Americans to literally choose between food and medicine. And over time, we're going to phase in more options for long-term care, making it possible for more elderly and disabled Americans to stay in their homes while receiving care, rather than being forced into nursing homes, as so many are now. Finally, this plan will put each of you in the driver's seat when it comes to dealing with insurance companies. Having small businesses and consumers band together in health alliances will level the playing field and give them the same bargaining power to negotiate lower rates as big businesses and large public employee groups have now.
So most of you, 7 out of 10 Americans in fact, will pay the same or less for the same or better coverage than you have now. But about 3 in 10 Americans will pay more, on average about $24 a month, in many cases for better benefits, including lower co-payments and lower deductibles, in every case for benefits that can never be taken away.
And health alliances will ensure that we'll all get high-quality care by providing consumers with quality report cards on every plan, showing you what services cost and what the health outcomes are. But in order to provide a system that will guarantee security for every American, healthcare reform will have to make the system work again.
I started out with training and experience that I've developed over the years to take care of patients. Now I find that increasingly, in fact, the greater percentage of my time literally is taking care of the bureaucracy, the paperwork.
The fastest growing department is the billing department because it's so hard to figure out the complexity of the system. And here we are in a situation where we're saying we can't afford to provide appropriate health care for our patients, and we're putting all this money into administration.
I see us spending money on specialists who do nothing but figure out how to pay one of hundreds of insurance companies because each one creates a different system for payment.
You have to get authorization for procedures, you have to get authorization for admissions.
There are forms that I filled out, must have been 20, 30 times. The same form, the same identical form, same question, every time.
These lawyers looking over our shoulder, waiting for anything that they might be able to convince a jury is a mistake.
In many instances, I will feel that particular procedures, particular tests, for example, are just not necessary. But I know that if I don't do them, it may someday come back to haunt me.
My medication costs me approximately $800 a month, approximately $10,000 a year.
I recently had an operation myself, which was extremely routine, and it's still $10,000 or $12,000.
If you look at an ICU stay of 2 weeks, it's going to be almost $80,000.
My son's medical bills for the last year were $85,000.
The insurance company raised our premiums from $6,000 to $16,000 in 2 years' time.
We're not talking about just cost of living increases or inflationary increases. We're talking about 3 or 4 times the increase in the cost of living.
I've had a rare opportunity to meet with literally thousands of Americans across our country. Their overriding message to all of us is that Americans can no longer wait for health care reform.
40 years from now, our grandchildren will find it unthinkable that there was a time in this country when hardworking families lost their homes, their savings, their businesses, lost everything, simply because their children got sick, or because they had to change jobs. Our grandchildren will find such things unthinkable tomorrow if we have the courage to change today.
Every American will receive a health security card guaranteeing a comprehensive package of benefits that can never be taken away under any circumstance.
This is our chance. This is our journey. And when our work is done, we will know that we have answered the call of history and met the challenge of our time. Thank you very much. And God bless you.
And so, we returned from looking at a brief videotape produced by the Democratic National Committee when they introduced the Clinton healthcare reform proposal. Joe, that was back some 9 or 10 months ago. Lots has happened since then. Can you give us an idea of what you've seen happen to the healthcare reform proposal?
Well, the first thing is that the special interest just came out of the woodworks using the time delay in presenting the plan to actually organize themselves and organize their PACs and their campaigns.
And let's say, who are we talking about here? The special interests. Who are the special interests in?
When you have, for example, the Health Insurance Association of America, the National Federation of Independent Businesses, the National Association of Manufacturers, the pharmaceutical companies, the insurance companies. I mean, and the list goes on and on. I mean, it's just absolutely incredible when you see the list of these various subsidiaries and subsidiaries of subsidiaries and affiliates of subsidiaries just that have come out to organize against this. It's incredible, and the amount of money that is now going into opposing this plan is absolutely incredible. Cooper, who has presented a bill, a Democrat from, I believe, Louisiana, who presented a plan, came to Connecticut, to Hartford, Connecticut, the insurance capital of the world, to do a luncheon in which he raised $2 million in an hour from these insurance companies just to oppose the president's plan.
With all due respect to the people in Louisiana, he's from Tennessee. I'm not sure the people in Louisiana would want to take credit for it.
I don't think they would. And certainly we don't, although we have a member of Congress here, Olympia Snow, who has signed on to Cooper's bill, and we can get into that later.
Yeah.
But so the first thing was that the time delay allowed the other side to organize and to come out and to actually dig deep into their pockets, and our pockets actually to use our premiums to go against what we and all Americans agree is a needed reform. The other thing is that they were very successful in putting out literature and ads on the TV, which Harry and Louise, for example, is saying, playing to fears of change, especially for people who are now covered by a plan that they consider either good or whatever, that is in part or most part paid for by their employer.
Right.
To play on those fears and saying, if we provide coverage to those other people, then you're going to lose your coverage. If that's what universal access means. And that was quite successful in raising that fear.
Yeah, I think that probably you know, from what I see, one of the really biggest problems with being able to get this message across effectively has been the ability of the insurance industry to play on the fears of the 85% who do have coverage, to think that expanding coverage to the others, A, would cost them, and B, would not in any way benefit them. And I'm not sure that the reform proponents did a very effective job in sort of trying to characterize why it is in your interest, if you're somebody who's covered by insurance, why is it a good idea for you that other people be covered?
Absolutely. I think that's critical, that the message really had to focus on two things. One, that costs are going up so dramatically. Just for example, here in Maine, in the last 2 quarters of last year, we saw our wage growth go down. And while medical inflation was running at 10% a year. So, and last year it was running at between 10 and 11%. So while the dollars that are coming into our households are going down, we're being asked to pay more. And it doesn't take the proverbial rocket scientist to figure out that after so many years of that, you're either going to drop it or be paying out a lot. And so and so that was that piece. I mean, is absolutely critical. Cost control is not is going to actually work in our favor. That was something that we need to get out even more effectively. Two is that universal access is a method of cost control. Once you get everybody in the system, then you can begin to look at how much is it costing us and why are these costs going up so fast? Where's the money going? Is it doctors are charging more? Is it hospitals are charging more? Where is the slack in the system? And when you don't have that, when you have all of these people, for example, here in Maine, 150,000 people without health insurance who can only access the system and get care in the most expensive way by going to the hospital emergency room, and those bills then being passed back on to us, the 85% with health insurance, then you're seeing the cost rise go up even more rapidly. So until we get everybody into the system, we're not going to have an effective way of controlling costs and stopping that shift. However, many people are reluctant to accept that because it's something, it's counterintuitive. But when you get into this, you rapidly realize that cost shift is real. That's going on now, and there's nothing that's going to be done about that until we get everybody covered. And I think that, one thing that I give credit to the American people is that when you look at the polling data, whether it be this year or even last year, after those intensive ad campaigns started, you had Pizza Hut and you had all these other major corporations coming out and insurance companies coming out and opposing and saying this is going to cost you, the middle class, more. Still, poll after poll after poll shows 80% of the American public supporting universal access, 80% of the public supporting cost controls, and so and high mid to high 80s supporting an employer contribution. People know that they don't have the money to shell out in addition to what they're already paying.
Well, now, in the case of many of our companies, unionized companies here in Maine and across the country, workers get their health insurance because they have bargained with their employer that the employer will provide health insurance coverage or provide, pay a great, portion of the bill for the health insurance coverage. But there are many other people, of course, who work for companies who don't offer that. And the proposal that was put forward by the president would have required, if I'm correct, every employer, big or small, every employer to make a contribution to cover the costs of their workers' health insurance, right?
Yes.
And that issue is one seized upon by some of the opposing groups, most particularly probably NFIB, the National Federation of Independent Business, to attack the reform proposal. And they've made that I would guess, one of the major causes of their campaign against it. And that's reflected in some of the other proposals that have come out, right?
Yeah, absolutely. There could have been nothing more insidious and wrong and misinformational than what the NFIB put out as their message, saying that if you go forward with healthcare reform, small businesses are going to shut down. If you go forward with the Clinton type of plan, which would have required employers to contribute to the cost of their coverage, that the jobs would have been lost. The thing that is left unsaid in that is that, one, under the Clinton plan, the subsidization of small businesses with fewer than 75 workers was absolutely fantastic. It was incredible. And it was based on the wages that were paid by those firms. And in Maine, we would have seen a lot of federal dollars coming in Maine to subsidize the huge number of small businesses that we have here in order to provide health insurance coverage for their workers. For example, there was the Maine People's Resource Center did a study and project with small businesses in Maine called the Small Business Project on Healthcare Reform. many of those small businesses who are not so ideologically bound with the blinders on, saying, oh, this is a Clinton plan or this is a Democratic plan and they're just going to be reaching into our pockets, all that typical hype, that actually went back to their businesses and looked at how much would they pay under the Clinton plan with those small business subsidies, said this is something that's going to help us. For example, we had small businesses telling us that the owner of the small business, which employs 5 to 10 workers, would actually pay less under the Clinton plan to cover everybody in their workforce than they are currently paying themselves for their own family. And so when you start looking at the numbers and the level of subsidy, you can see that what the NFIB did was absolutely wrong and is going to hurt small businesses.
I was going to say, the plan that the president outlined was the initial version of what the administration wanted to try to accomplish with healthcare reform. And without going through all the twists and turns, it's suffice it to say that the bills that are going to be presented to the Congress to be voted on in the next week or two are going to be a far cry even from what the president had started with. But let's maybe try to contrast the two different types of approaches to healthcare reform that, at least in my view, Clinton sort of came down somewhat in the middle on. And that is, on the one hand, there is a proposal that, as you had mentioned, by Representative Cooper of Tennessee, that Olympia Snowe has signed on to as one of the co-sponsors, as one approach, something that they called managed competition. And on the other hand, there's the proposal that has been introduced by Representative McDermott and Senator Wellstone that other organizations, including our own union and Consumers for Affordable Health Care, have endorsed as a single-payer approach. And I wonder if you could just very quickly give our viewers the benefit of your analysis as to what are the differences between those two approaches to healthcare reform.
They're night and day. Under the McDermott single-payer bill, everyone would have coverage. The administration would be simplified in the sense that you would no longer have insurance companies, 200 insurance companies in Maine, each with all the different rules and regulations about who can get coverage and who can't get coverage, and all their different prices and all their schemes in order to bring you in and then whack you in the end and tell you, I'm sorry, you didn't read the fine print. It would have eliminated all that paperwork and saved, it's estimated that in Maine alone it would save about $60 million, enough to insure all of our uninsured. And it would have put in strict cost controls. And that is something that's absolutely essential to keep costs from continuing to rise, reallocate the savings that we gain by the cost controls back into needed services like preventative health services and primary care instead of putting it into the specialty care. It would have controlled drug prices, and the financing would have been fair.
Okay, how would that be financed? Single-payer approach, everybody gets covered, insurance companies are out of the deal. How is it paid for?
Yeah, they basically, it was a progressive tax in which employers would be, their contribution would have been cut in half. I mean, right now we have employers who are paying upwards of 12 to 15% of their payroll for health insurance. And it would have required the employer to contribute 7.9%, 8% of their payroll for health insurance. It would have required the employee to kick in between, depending on your income, between 0 and 2%. And so it was a very, very affordable plan. I figured out, for example, for my own family, that full health insurance coverage would have cost my family about $1,500 less a year than we're paying now. And it would have cost, basically for a family of 3, it cost us about $800 a year, which is fantastic. I mean, how many, there's no plans that would save.
Okay.
On the other side,
real simple, just again, for people who are working in some of our shops, just to do the math, your employer right now is contributing, in many cases here in Maine, 14% or more of payroll for health insurance. And under the proposal that was talked about, that would mean your employer would only pay 7.9%. That's a big savings to the employer. The employer, under a contract, would have to bargain with us about what to do with the savings. And guess what? We'd probably want to bargain that those savings be redirected into much-needed wage increases. So the bottom line is there is more money that would be saved in the system for many of the companies under that approach. Pretty simple.
Absolutely.
Okay. Now, that's the McDermott-Wellstone so-called single-payer approach.
Right.
On the other hand, we've got Cooper and Snow and others who are proposing some other kind of reform. And
Yeah.
what's that all about?
On the other end of the scale, there are bills like the Chafee bill, Senator Chafee from Rhode Island, his bill, which Senator Bill Cohen has signed on to, and in the House of Representatives there is the Cooper and Michael bills, which Representative Snow has signed on to, and those bills do not provide universal coverage. They do not have cost controls. In other words, there's no control on how much you would spend in premiums. There is no control on how much you would spend in co-pays. There's no limit on what you would pay as a family in deductibles and out-of-pocket costs for services that are not covered. Absolutely no limits in those. The other thing is that it is what is referred to as an individual mandate, meaning that your employer, and for those people in your audience who are listening who have their employer contributing 80% or more for their health insurance coverage, the Maine People's Alliance pays 100% of our workers' health insurance coverage, would no longer have to do that. And the cost of health insurance would be borne by the citizen, the individual. And that would, shifting $5,000 cost. How many families in Maine could absorb an additional $5,000 in costs? And that's, in essence, where those bills are coming from.
Okay.
And just talk about, the critics of the Clinton plan are saying, oh, it's government gone wild. But in the Cooper and Michael and Chafee bills, which Snow and Cohen have signed on to, they say that if the individual does not purchase health insurance, that the IRS will come and be able to basically garnish their wages to make sure that they purchase health insurance coverage. And this is coming from the anti-big government party. So, it just gives you the broad spectrum that Clinton is dealing with.
Right, and so the Clinton administration came in with their proposal somewhere between these two extremes, call them that, and their proposal is now being hacked at and whacked at and messed with going through the congressional process. It's what they say about you don't want to watch them either make laws or sausages, and this is sort of making sausage out of a law, I think. And we are about to find ourselves tomorrow with a proposal that Senator Mitchell will be sponsoring in the Senate to be what I'm sure he will consider to be the best thing he's going to be able to get. George is good at counting the votes, and there's not enough votes for, the single-payer approach would be his argument, I would think. We've heard him make that, so I suspect he'd still make it. And not enough votes, apparently, for an approach that the administration has of requiring employers to contribute 80% of their workers' health insurance premium. So we don't know what that's going to be. And I wonder, maybe you could speculate about what do you think it's going to be? What do you think the outlines might look like of what emerges from the Congress in the next few days?
We've seen in the House that Dick Gephardt is introducing the House Leadership Bill, which takes us back to the days when the proposal was we are going to have universal coverage, that there's going to be an employer contribution at the level of 80-20, that we're going to have various subsidies for businesses, and I think that is really critical, as well as, and this is critical to the state of Maine, a very rural state, that we have as a state the option of doing a state single-payer opt-out, and I think that is what we're going to see moving through the House. On the Senate side, there are two critical pieces that have not been decided, but there have been murmurings that universal access may be phased in over the period of another 8 to 10 years. In other words, we wouldn't reach full universal access until year 2002. And again, that's going to have a traumatic impact on costs, because the more people that lose their coverage as we move forward, the higher the costs are going to be, because they're going to continue to use those emergency rooms. The second thing is that what we most likely will see is a 50-50 employer-employee share of the cost. And I've brought some information about what does that mean here in Maine. It sounds nice, oh, 50-50, you know, it sounds reasonable, let's share in the cost. But when you get down to the actual dollar amounts, it's quite substantial. For example, with regards to the 50-50, that type of cost sharing, for a two-parent family with children, that would require them over the 20% that they're already paying under these 80-20 plans. That will require an increase in their spending out of pocket of almost 6% of their family budget. And it's not hard to figure out. You got a $25,000 income, 6% more of that income is going to be going to your health insurance costs. And that's at a 50-50 cost share. And again, that's only the amount of increase over what you're already spending. So it's a large number. For single parents, it's going to be more than 4%, about 4.2%. Those are significant numbers. That's I mean, just to go into the actual dollar amounts, for two-parent families, that's an additional $1,500 a year.
And that's opposed to what's been proposed by the President's plan. So this is money that would be just redirected from what the employer would pay to what the individual would pay.
Oh, yeah.
We're just talking about shifting money here and who's going to pick up the tab.
Oh, yeah, you have less take-home, and it's going to an industry with no controls. It's just out of control.
Okay. Not a very warm prospect for us, and for many people who've been working for reform of the healthcare system now for some time. And we don't really have a crystal ball. We don't know what's going to happen over the next few weeks. But I think one thing that's clear is going to happen is we're not going to have passed at the national level the type of healthcare reform that's really going to solve the problems that we've been talking about here in Maine. And what I would think that we might be looking to in Maine is the ability for Congress to essentially give us the right and the ability to craft our own fix to this problem. And you made reference to the state single-payer option that you hope will be in the House version of this bill. Talk about that just for a little bit, because I'd like to spend the balance of our show talking about what is it that we may be doing here in the state of Maine once the dust settles on this thing.
Right now we have a commission called the Maine Healthcare Reform Commission. It's made up of 3 commissioners that has already begun its process of developing 3 plans: a single payer, a multiple payer system like something like we have now, and a system with regulations, I should point out, which we really don't have lots of regulations or many regulations at all within the insurance industry now, and a third system which basically just is an enhancement of our private insurance system. And those 3 are supposed to provide universal access to everyone in the state of Maine. And over the course of the next, until November of next year, that commission will be going around and taking testimony of citizens and creating the environment for people to bring forward their stories about what has happened to them, and will analyze those stories and try to craft a system that basically addresses those concerns. The people on the tape that you heard say, once you lose your job, you lose your coverage, or if you go to part-time, you lose your coverage, or if you have a pre-existing condition, you lose your coverage. Happily, because of our efforts here in the state of Maine, that no longer is a possibility, but those types of things are what people can come forward and say, this is my experience, and I'm expert in what I know happened to me. I spent, an X number of days in the ICU, or my child spent X number of days, and it was a $30,000 bill. So those types of things are going to be absolutely critical, and it's going to be up to citizens of Maine to make this work.
There's been so much talk here about Maine's business climate and what is it that we can do about economic development and economic growth for the state of Maine, because we are in such, such a down economy, and our citizens, have such a low standard of living relatively, and things are getting worse, not better. How is it that you would see healthcare reform that we might be able to do here in the state of Maine under a single payer approach to be good for our business climate? How is it that we would improve our economic situation by adopting a state single-payer system?
I think absolutely hands down the cost savings in a single-payer system, because you don't have all of these fat cat insurance companies out there raking off the profits, will generate substantial savings. We have various elements within the American Medical Association, the surgeons within the American Medical Association saying they support a single-payer system because they realize that the trade-off that they get is they get the insurance companies off their back. And they get all this reduced paperwork, and it saves their overhead. I mean, doctors are projecting that 25 to 40% of their office costs, operating costs, just go to paperwork alone. For consumers, we see that savings too. We don't have to deal with an intransigent bureaucracy within these insurance companies who really don't give a damn whether you get health insurance coverage or not. They're just interested in your money. So hands down on the administrative savings, as well as the streamlined and understandable system. You know where you go. Everybody has their choice of doctor. And it's not a government-controlled system, as we find our colleagues in Canada and other countries in the world that have gone to single-payer systems saying, especially the providers, it has actually reduced the paperwork, and it has taken the monkeys, these insurance companies, off our back, which are constantly looking over our shoulder saying, you can't do that procedure. So for businesses too, and I think this is really an important piece, businesses will see, again, their cost halved. Most businesses that are paying for health insurance now. But for small businesses who have been whacked hard by, for example, workers' comp costs, in a single-payer system, you have the ability to take the medical component of workers' comp, those insurance premiums, those workers' comp insurance premiums, which the medical component right now runs between 30 and 40% of those premiums, completely eliminated and put into the health insurance system. In other words, the cost for that medical component would all those things, it wouldn't matter where the injury took place, it wouldn't matter what the health problem was, it would all be covered by the insurance system, the health insurance system. So that is a big savings to small businesses.
See, I think that there's some lessons we learned from the experience that we've had over the last year at the federal level of trying to get healthcare reform that was, in some ways trying to be all things to all people. The Clinton plan, which, as we said, is somewhere in the middle between the different general approaches to reform. The insurance industry and others went after it in a big way, and they, with the TV commercials and the a huge lobbying campaign that has really had an impact and is going to result in some type of federal legislation, if it gets passed at all, being a far cry from any kind of fundamental reform. It'll be hopefully a step, but a small baby step in the right direction. And we have in Maine, I think, on a proportionate basis, more people who've got their heads screwed on right about this stuff, and who can probably see through the distortion and the fog created by the insurance lobby on the federal level. So where last year when we were trying to pass legislation in Maine, and would have people come up and say, well, you have to wait, we got to wait and see what Washington does, we have to be in compliance with what happens at the federal level. Well, I think we'll have been down that road. And I think it's important that people in Maine who are concerned about our economy and concerned about their own family security need to be very much aggressive about saying we need to do a significant type of change in our system, because playing around the edges and tinkering in a way that really doesn't change the power relationships at all is not going to fundamentally change the dollars involved in healthcare.
Absolutely.
So we have an opportunity, I think, in front of us.
Yeah, absolutely. And I think that when Congress comes peddling their wares of this is what we would like you to accept, this is the best we could do, that the response has to be, why do you get 75% of your premiums covered by us, your employer, when what you're trying to sell us is either the snow version of no contribution or some middle ground of 50% coverage? I think that we have to ask ourselves that hard question. And the other thing, Mike, I think that's absolutely essential is that we stop the wholehearted exception of these ads that you see on TV and with Harry and Louise, and we got to start asking ourselves, does this make sense in my own personal life? I mean, are we really, do we really believe that the insurance industry is going to deliver us a reformed health insurance system? And I think that those are hard questions that we have to ask, but we have to be very, very watchful of what's going on.
I think in closing here, what the point I think that we're making is that while we are on the verge of what is being cast as a historic debate and vote in Congress, and it will be. I mean, this is, they've not gotten this far with real health care reform, since the passage of Medicare. Nonetheless, there doesn't seem to be any reason to believe that this congressional action, whatever it may be, is really going to solve our problem. Best case, it's not going to do any worse, or maybe somewhat better. But we are going to have, this is in some ways the beginning and the opportunity for us in Maine. We'll have a new legislature, we'll have a new governor, whoever that person might be. But what we do have as a constant is we still have citizens and businesses in Maine that need a way to change this system, because it's not affordable, and it's not doing the job for us now. And I know that viewers can count on hearing more about the efforts to reform the healthcare system in Maine here on Cavanaugh's Corner. You can count on the fact that your unions will be active in the effort to reform Maine's healthcare system. And I know, Joe, that you're going to be part of that, and Maine People's Alliance will be.
Absolutely.
So thank you for coming.
Well, thank you, Mike.
And thank you, viewers, for tuning in to another edition of Cavanaugh's Corner. And we will return with a post-mortem on the on the congressional vote, and hope someday to have an opportunity to talk with some of our congressional representatives, maybe Congressman Snow, Congresswoman Snow, Congressman Andrews, soon to be Senator, one of them, about what role they played, where were they when the votes were counted on health care reform. So thank you again. We'll be back. And Richard, I forgot to give you the simple plan. I could just prop that up there. This is health care reform according to Senator Bob Dole.
I love Bob Dole.
Really. And you, I assume, have no more audio on this. You best not.
Actually, I do.
Ooh. This is, we have, the music comes up now. See, we have the technicians back in the studio that bring up the music, and the lights fade, and the credits dance across the screen. It's really a great piece. Is that, can you focus right here?